Hello everyone, I am Surbhi Vora and today's topic is dermatomes. So what are dermatomes? Dermatomes are areas of skin that send signals to the brain through the spinal nerve. These signals give rise to sensations involving temperature, pressure and pain. फॉर एग्ज़ाम्पल सपोज किसी ने हमको पिंच किया तो हम क्या करते हैं, एकदम से एक प्रोटेक्टिव मैकेनिज़्म अप्लाई करते हैं, जल्दी से वहाँ से अपना हाथ हटा लेते हैं क्योंकि हमको पता है कि उस चीज़ से हमको पेन होने वाला है. तो आप खुद सोचो कि ये जो पेन हो रहा है इसका सिग्नल्स कोई ना कोई चीज़ तो होगी बॉडी में जो ब्रेन तक पहुँचाती होगी. सो ये सिग्नल्स पहुँचाते हैं स्पाइनल नर्व्स. इस तरीके से बॉडी में अलग अलग स्पाइनल नर्व्स डिस्ट्रीब्यूट होते हैं जो डिफरेंट एरियाज के सेंसेशंस को ब्रेन तक पहुंचाते हैं. सो डर्मेटोम्स आर यूजफुल टू हेल्प लोकलाइज न्यूरोलॉजिकल लेवल. ओके, सो अब हम इस चीज़ को एंटीरियर और पोस्टीरियर व्यू दो तरीके से देख सकते हैं, राइट. फॉर एग्जाम्पल, ओके, सो लेट्स स्टार्ट विद सर्वाइकल स्पाइनल नर्व्स. There are 7 cervical nerves, C1 to C7. So first, C1 supplies to vertex of skull. C2, you can see forehead occiput region. C2, forehead occiput. C3 supply neck and temporal area. C4 supply shoulder, clavicle and upper scapular area. C5 supply deltoid anterior arm till the thumb, till the base of thumb, right. C6 supply anterior arm or radial side, anterior arm or radial side of arm to thumb up to index finger. Then we come to C7. C7 supplies lateral part. C7 supply lateral part and forearm to index. C8 supplies mainly medial part, medial side of the arm and forearm to little finger. So clear? Again I will repeat. C1 supply vertex of skull. C2 forehead occiput. C3 neck and temporal area. C4 shoulder, clavicle and upper scapula. C5 deltoid anterior arm till the base of thumb. C6 supply anterior arm, radial side of arm to thumb or index finger. C7 lateral arm and forearm to index and ring finger. And lastly C8 medial side of the arm and forearm to ring and little finger. Okay. So after cervical, next come to thoracic spinal nerves. There are 12 thoracic spinal nerves, T1 to T12. T1 supply medial side of forearm to base of little finger. You can see T1 supply medial side of forearm to base of little finger. T2 supply medial side of upper arm. You can see upper arm medial side to medial elbow, pectoral and midscapular area. T2 supply medial side of upper arm to medial elbow, pectoral and midscapular area. So next come to T3. T3 to T12, we divide it into 3 parts. From T3 to T6, upper thorax. T5 to T7, costal margin. T8 to T12, abdomen and lumbar region. I repeat again, T3 to T6 upper thorax, T5 to T7 costal margin, T8 to T12 abdomen and lumbar region. Now next comes to lower limb, lumbar spinal nerves, right? Okay. So now see from anterior as well as posterior view for lumbar spinal nerves. First, L1. L1 supplies to back, okay, and also over trochanter and groin region. So L1 supplies to back, over trochanter and groin. L2 supplies to back, right. front of thigh and knee. L3 supplies to also back, upper buttocks and anterior aspect of thigh and knee up to the medial lower leg. Next, L4, medial buttocks, right? L4 is for medial buttocks, lateral thigh and medial side of leg up to the dorsum of foot or a great toe. And last is L5, which is also supplied to the buttock from back and posterior and lateral thigh. L5 is also supplied to lateral aspect of leg, dorsum of foot and first, second and third toes. Okay, so now from posterior view, L1 to L5 also supplies to the posterior aspect of thigh or a knee, right? So after lumbar spine, next come to sacral, S1 and S2. You can see S1 and S2 supplies to the buttocks, thigh and posterior aspect of leg. Next, S3 supplies groin and medial thigh to the knee. Okay, S3 supply groin, medial thigh to knee. S4 supply perineum and genitals. S4 supply perineum and genital organs and also lower sacrum. So these are total spinal nerve roots from C1 to S4. I hope it is clear.